Hello. It's your girl boss lady. I welcome you all to my channel. Our NCLEX review today will be on the topic arterial blood gas analysis. Remember to click on the pause button and take time to think out your answer before the correct answer is given. Practice timing yourself at your own pace.
Now, let's begin. The first question. Carl, an elementary student, was rushed to the hospital due to vomiting and a decreased level of consciousness. The patient displays slow and deep small breathing, and he is lethargic and irritable in response to stimulation. He appears to be dehydrated. His eyes are sunken and mucous membranes are dry, and he has a 2-week history of polydipsia, polyuria, and weight loss. Measurement of arterial blood gas shows pH 7.0, partial pressure oxygen of 90 mm mercury, partial pressure of carbon dioxide of 23 mm mercury, and bicarb of 12 mmol per liter. Other results are sodium 126 mmol per liter, potassium of 5 mmol per liter, and chloride 95 mmol per liter. What is your assessment? Now, before I give the right answer, I want to give you some tips on how to solve arterial blood gas (ABG) questions. First of all, you need to know the normal value ranges of the most important arterial blood gases as shown on the screen. They include arterial blood pH, normally referred to as pH, partial pressure of carbon dioxide, normally referred to as PaCO2, bicarb, normally referred to as HCO3. Also note that the ABG or acid-base imbalances are caused or regulated by either the respiratory system or the metabolic system. So, when the respiratory system is in trouble, the metabolic system may lend a helping hand to either fully compensate or partially compensate the problem. Same applies to when the metabolic system is in trouble. The respiratory system may set in to assist and compensate for the problem. Now, a complete or full compensation is when the pH is within the normal range. Partial compensation is when all 3 elements are out of their normal range, as shown on the screen. Uncompensated results is when only one element, either carbon dioxide or bicarb, is within the normal range. Now, to determine which acid-base imbalance a patient is having, we use the mnemonic ROME, as shown on the screen. A lower than normal pH will put the patient in a state of acidosis. A higher than normal pH will put patient in state of alkalosis. So, we first check the pH to see if it's low acidosis or high alkalosis. Secondly, we check carbon dioxide if it is in the same direction as the pH or it's in opposite direction. What I mean is, you check carbon dioxide value if it's low when pH is low, or high when pH is high, which means they are in the same direction, or whether carbon dioxide is instead low when pH is high, which means they are in opposite directions. So now, we say the problem is respiratory when the pH is opposite to carbon dioxide, and metabolic when the pH is in the same direction as carbon dioxide. So, an unstable patient can either be in a state of respiratory acidosis, respiratory alkalosis, metabolic acidosis, or metabolic alkalosis. Don't worry if you find some difficulties grasping this concept, but as we solve each question, the trick will come to you easily. Now, let's move on to answering our questions. The correct answer is option 4. Remember our Rome mnemonic. ROME. Respiratory, opposite. Metabolic, equal. We first look at the pH given to know if it's low or high. pH is 7.0, which is below normal range, and a low pH puts our patient in a state of acidosis. The next thing we check is carbon dioxide. Is it opposite or in the same direction with the pH? Carbon dioxide is 23, which is below normal range, and so it is in same direction equal with pHs. pH is low when carbon dioxide is also so. Remember metabolic equal. It means that it's a metabolic problem. So, the patient is in metabolic acidosis. Now, we say it's partially compensated because none of the three elements are within their normal value ranges, as explained earlier. That is how we got our answer. Hope it's getting more understandable. Next question. Ricky's grandmother has been suffering from persistent vomiting for 2 days now. She appears to be lethargic and weak and has myalgia. She is noted to have dry mucous membranes and her capillary refill takes greater than 4 seconds. She is diagnosed as having gastroenteritis and dehydration. Measurement of arterial blood gas shows pH 7.5. Partial pressure of oxygen 85 mm mercury. Partial pressure of carbon dioxide 40 mm mercury. And bicarb 34 millimole per liter. What acid-base disorder is shown? The correct answer is option 3. Now, let's work it out. First, look at the pH value to check if the patient is in a state of acidosis or alkalosis. That is, low pH or high pH. The pH given is 7.5, which is above normal range, meaning the patient is in a state of alkalosis. Let's then check the carbon dioxide or bicarb value to know if it's in the same direction as the pH or it's in the opposite direction. Carbon dioxide is 40, which is within normal range. So we move to bicarb. Bicarb is 34, which is above normal range, same as pH, meaning they are in same direction. Remember ROME, R-O-M-E. Respiratory opposite, and metabolic equal. So, the patient is in metabolic alkalosis. And we will say it's uncompensated because one of the elements is within normal range. As you can see, carbon dioxide is within normal range of 35 to 45 mm mercury. Next question. Baby Angela was rushed to the emergency room following her mother's complaint that the infant has been irritable, difficult to breastfeed, and has had diarrhea for the past 3 days. The infant's respiratory rate is elevated, and the fontanelles are sunken. The emergency room physician orders a BG after assessing the ABC. The results from the ABG show pH 7.39. Partial pressure of carbon dioxide 27 mm mercury, and bicarb 90 microequivalent per liter. What does this mean? Before I give the correct answer, remember our mnemonic, ROME, R-O-M-E. It does not go for all acid-base imbalance questions, especially those with pH within normal range. It's difficult to know if it's in acidosis or alkalosis because the pH is neither low nor high. Let me give you tips on how to answer these types of cases. First of all, read through the question again to determine which system is causing the imbalance. Check. If the cause of the problem is related to the lungs, then it will be respiratory. And if the cause of the problem is not related to the lungs, then it's metabolic. Okay then. To know if it's acidosis or alkalosis when related to the lungs, check if the patient is having rapid breathing or slow, difficult breathing. When the patient is having rapid breathing, they breathe out their carbon dioxide or acid, leaving a high concentration of alkaline in the blood. Alkalosis. The opposite happens when the patient is having slow breathing. They hold back carbon dioxide or acid, thereby increasing the acid concentration. Acidosis. On the other hand, when it does not involve the lungs, and they talk of vomiting or suctioning, then they are removing acid out of the system, leaving the patient in alkalosis. But if the question has nothing to do with the lungs, and there is no vomiting or suctioning, then your default answer will be metabolic acidosis. Trust to have this as the correct answer in such cases. Let's then move to answering our questions. The correct answer is option 3. The cause of the problem has nothing to do with the lungs, and so the diarrhea for 3 days is a metabolic problem, and since it's not vomiting or suctioning, it's metabolic acidosis. And we will say it's a full compensation because the pH is within normal range. Hope it's more understandable now. Next question. 3-year-old Adrian is admitted to the hospital with a diagnosis of asthma and respiratory distress syndrome. The mother of the child reports to the nurse on duty that she has witnessed slight tremors and behavioral changes in her child over the past 4 days. The attending physician orders routine ABG. Following an assessment of the ABC, the ABG results are pH 7.35, partial pressure of carbon dioxide 72 mm mercury, and bicarb 38 microequivalent per liter. What acid-base disorders show? The correct answer is option 2. The pH is within normal range, so we read the question again to determine which system is causing the imbalance. The asthma and respiratory distress syndrome is a respiratory problem. Next is to determine if it's an acidosis or an alkalosis. A patient with asthma have difficulty breathing, thereby holding back carbon dioxide which was to be sent out when breathing. Carbon dioxide retention is acid retention. Acidosis. So, the patient is in a state of respiratory acidosis. We will say it's full compensation because the pH is within normal range. If you enjoy what you have seen so far, click on the like button and subscribe or follow this channel. Next question. Dale, a 6-year-old boy, was rushed to the hospital following her mother's complaint that her son has been vomiting, nauseated, and has overall weakness. After a series of tests, the nurse notes the laboratory results. Potassium 2.9 microequivalent. Which primary acid-base imbalance is this boy at risk for? If medical intervention is not carried out, the correct answer is option 4. Let's solve the question together. There are no BG values provided, so we read the question over again to determine which system is causing the imbalance. The problem is not related to the lungs, though it's a metabolic problem. Let's then determine if it's an acidosis or an alkalosis. Remember, the patient has been vomiting, sending out the acid from the GIT, leaving the body in a state of low acidity. Alkalosis. That's how we got our answer.
We have come to the end of this session as I did not want to make a very long video. Please drop a comment to let me know which topic you want us to review next or you want more on this same topic. Don't forget to like and subscribe to this channel so as to get latest updates. We thank you all. Bye.